Chapter 14, Nutrition for Childbearing. I talked about recommended weight gain earlier. The amount goes by pre-pregnancy BMI. Table 14.1 breaks down this for you. This is very individualized and the provider will discuss it with the patient. The pattern of weight gain is just as important as the amount. Approximately 1.1 to 4.4 pounds should be gained in the first trimester. This is a time when many women may be nauseated and the fetus needs fewer nutrients. For the rest of pregnancy, normal weight gain should be about 0.8 to 1 pound per week. Once again, this is for the woman with a normal pre-pregnancy BMI. An increase in nutrients is needed during pregnancy to meet the demands of the mother and the fetus. No added calories are needed in the first trimester. An additional 340 is needed during the second trimester, and an additional 452 calories in the third trimester. I'm just going to touch base on a few more important nutrients during pregnancy. Folic acid can decrease the occurrence of neural tube defects such as spina bifida, anencephaly, and could also reduce the risk of cleft lip and palate and some heart defects. The intake is important before conception. Healthy People 2020 guidelines include all childbearing aged women should take at least 400 micrograms of folic acid each day. The new recommendations are 400 to 800 micrograms daily. This amount should be taken at least 1 month before conception and at least 2 to 3 months after conception. An increase in iron is needed for the increase in the maternal red blood cells during pregnancy. The infant will take the needed iron from the mom, so it's important that she has adequate intake. Many women do not get enough, so many are placed on iron supplements. Table 14.4 lists foods high in iron. It's a good idea to know which foods are high in iron. You will be expected to educate on this in clinical, and you may see it on a quiz or a test. Calcium is transferred to the fetus, especially during the last trimester. Mom can basically store calcium until it is needed by the fetus. The needs are not changed during pregnancy or lactation. Dairy is the best source of calcium. Box 14.1 lists alternative calcium-enriched foods besides milk. Sodium needs increase during pregnancy due to the expanded blood volume and the needs of the fetus. Sodium doesn't need to be restricted during pregnancy, but high sodium foods should be limited. They are listed in box 14.2. Many women are prescribed prenatal vitamins during pregnancy. Adequate nutrients besides folic acid and iron can be obtained from the diet, and that is the preferred method to obtain the nutrients. Water is very important during pregnancy due to the increased blood volume and as part of the maternal and fetal tissue. Pregnant women should consume 8 to 10 cups of fluid a day, with the majority of that being water. Water is also important to prevent dehydration, which can cause preterm labor. There are certain foods that should be avoided during pregnancy. One of these foods is large fish, as they may contain high levels of mercury, which can damage the nervous system of the fetus. Small fish typically have smaller amounts of mercury and are okay to eat. Raw fish should be avoided due to the possibility of parasites and bacteria. Certain foods can contain listeria and can cause abortion, premature labor, infant death, or severe illness in the infant. Foods that contain listeria include luncheon meats and hot dogs. Others include soft cheeses, unpasteurized milk or milk products, or undercooked meats or poultry. Eggs need to be fully cooked to be consumed during pregnancy as well. Toxoplasmosis can be contracted if a pregnant woman eats raw meat, unwashed fruits or vegetables, and it can be contracted from cat feces, so pregnant women should not empty or clean litter boxes. There are factors that influence nutrition. One of course is the age. The adolescent needs nutritional support for her own body, but then needs more for the fetus. As a nurse, one of the first things we do before we educate is to find out their knowledge regarding nutrition. I've worked in many community events where I would educate on nutrition and certain foods to avoid or to have to meet their needs, and it amazes me how many people really do not know what is healthy. If you ask them if they know what a healthy diet is, they may say yes when they really don't. It's better to ask and tell them ask them what does a typical day look for you food-wise. So many people think salads are healthy. They can be, but if they're putting on bacon, cheese, and a ton of dressing, they're not so healthy. Always find out their knowledge level first. Exercise can influence nutrition as well. Moderate amount of daily exercise is recommended in a non-complicated pregnancy. If they exercise more strenuously, they will need additional calories and nutrients, so assess their exercise habits. Culture is a big factor as well. You must assess if they understand or can read English. Some cultures believe foods are either hot or cold, and this must balance. Getting a basis of their beliefs can help us determine correct guidelines for them. There are, of course, some risk factors associated with nutritional deficits. Socioeconomic is a big risk factor. Many do not have the financial means for good nutrition. There are programs that can help. WIC, which is Women, Infant, and Children, is an excellent program that helps pregnant women get healthy foods. You must financially qualify for these programs, and many times they are carried on to postpartum and needs for the infant. If an infant has certain health conditions, they can qualify for WIC even if they do not qualify financially. Providing the pregnant moms with info for WIC, if they do not already have so, is a good thing to do. We already talked about the adolescent and nutrition. Many times they still require extra nutrients, or they just have poor eating habits, so education needs to be provided to them. One issue that adolescents can have is body image. They may not want to gain too much weight, so they won't have too much to lose after the baby is born. Helping them come up with a well-balanced diet is something we need to do. Remember, you must assess what type of foods any person likes before we provide this education. We all know someone who hates vegetables. Telling them to eat 4 servings a day is probably not going to happen. Coming up with a plan of other foods that contain those same nutrients can help. Vegetarianism can be a problem during pregnancy for some women. They need to find alternatives to the foods they do not eat, so they still are getting a well-balanced diet. They may need supplements during pregnancy to ensure they are getting all the recommended requirements. Encourage a woman experiencing pregnancy nausea and vomiting to eat 6 small meals a day. Try to avoid fried foods. Typically, proteins and complex carbs are better tolerated. Eating crackers or dry toast before getting out of bed may help. Also, drinking liquids between meals instead of with meals can help some women as well. We talked somewhat about anemia earlier. Many pregnant women will experience anemia during pregnancy as the fetus needs the iron and the extra blood volume is being diluted. Encouraging those foods high in iron is good, and if she's prescribed iron supplements, encourage compliance with this as well. Some women have abnormal pregnancy weight. Ruling out eating disorders is something that needs to be done. Women can suffer from anorexia, nervosa, or bulimia. Many women will have food cravings or food aversions during pregnancy. There is no known cause why women experience them, but it could be from their change of taste and smell during pregnancy. These typically are non-harmful. Pica is eating non-food or some food components not considered part of the normal diet. Examples can be ice, dirt, laundry soap, paper, coffee grounds, or numerous other things. The cause is not known, but sometimes can be related back to an iron deficiency. Many of these can be harmful and need to be addressed with the provider. Women who have had a child before are at a higher risk of starting this next pregnancy with some nutritional deficits. A woman who is multifetal will need to gain more weight and need additional nutrients. If not met by her diet, supplements may be needed. Many times substance abuse follows an unhealthy lifestyle. Many times it's due to no money left for food, or the substance they use decreases their need to feel they need to eat. A few substances we need to be aware of are smoking, your nicotine, caffeine, alcohol, and drugs. Nicotine increases metabolic rate and decreases appetite. More research is needed regarding caffeine. Small amounts seem to not have any negative effect. Alcohol can cause alcohol fetal syndrome for the infant, so at this point all alcohol should be avoided. Many drugs cause harm to mom and fetus, so discourage any drug use. Many can be appetite suppressants and cause nutritional deficits as well. For women who are breastfeeding after birth, they will need an additional 330 calories the first 6 months, and then need an extra 400 calories for the next 6 months. A reminder to new moms is it should be a well-balanced diet and to discourage dieting without assistance from the provider or nutritionist to ensure she is getting adequate nutrition for herself and the baby. Most women will burn more calories by breastfeeding than those who do not breastfeed, so for most women who are breastfeeding, they can follow that healthy, well-balanced meal plan, and once okayed from the provider, start exercising and she will see the extra weight come off. Both lactating and non-lactating moms should be sure to include vitamin C and protein in their diet to promote healing. The non-lactating mom can return to her pre-pregnancy diet after birth. Once again, the best weight loss results are going to include a well-balanced diet along with exercise once that is allowed.